No, I'm Dr. Mary Van, a clinician at ThriveX.
Okay, so what do you think of me doing a little
Dr.
acupuncture first for about 10 minutes?
Care Wellness Center, and we are going to combine two different therapies. One traditional Eastern, which is the acupuncture component, where he's a doctor of acupuncture and oriental medicine, and Western treatments, which is going to be the nutrients. Lynn has what we think is early stages of rheumatoid arthritis. So rheumatoid arthritis is probably the most classic and well-known of autoimmune conditions, which is basically your own body attacking the joints. So we want to use methylcobalamin to drive down two factors. Number one, homocysteine. Homocysteine is an amino acid that the body produces. In normal levels, it's fine, but when it begins to reach high levels, it becomes highly inflammatory. In fact, it's a biological marker for patients who can have cardiac problems. And for some reason, we noticed that patients with rheumatoid arthritis usually have elevated levels of homocysteine. So what we're going to do is we're going to try to drive down the homocysteine levels by adding methylcobalamin. Now, methylcobalamin, also known as B12, is going to convert the homocysteine to another amino acid called methionine. So basically, the homocysteine and methylcobalamin are going to join together and produce a beneficial amino acid, which is the methionine. Methionine you like because it drives cholesterol out of the liver, it's regenerative for the skin tissue, and actually also helps reduce inflammation as well. So that's one factor. The other factor is that we're beginning to find that methylcobalamin is involved in the autoimmune or the immune response, and that high levels of B12 can actually push down lymphocyte activity. And since autoimmune condition is your body attacking itself, you're actually down-regulating the body from attacking itself. People aren't that familiar in the Western culture about acupuncture, and they're not 100% sure why that would benefit rheumatoid arthritis. But there are some new studies coming out that show, from a molecular point of view, that acupuncture actually downregulates certain macrophages, particularly M1 macrophages. And M1 macrophages are known to be pro-inflammatory, versus M2 macrophages are anti-inflammatory. And it's been shown that acupuncture decreases the activity of M1 macrophages and increases M2 macrophages.
And explain what chi is, because a lot of people don't realize
Chi is the energy that flows through the body in meridians, and when someone has some type of disease, some type of disorder, any condition, it's usually an obstruction of that energy, that chi force flowing throughout the body. So what the needles do is unblock that flow and allow a person to heal naturally.
So here I am. I'm just giving a 2-day feedback from my B12 injections in 3 areas of my hand. 1 was my thumb area and 2 were in my wrist portion. I just want you to note that my inflammation is really down at least 50% in my wrist. And my thumb, I actually have to say my thumb has the most dramatic results. I can now bend it backwards, which I could not do. And I don't have as much pulling in my thumb, so I'm really happy with the results on those injections, and I have more mobility. So I would say at least 80% more mobility and 50% inflammation in my wrist. As you can see, you cannot see any raised portion in my wrist area, and my thumb not at all. So I'm very happy so far with the progress that I've had based on those injections. Thank you so much, Thrive Spa. This is awesome.